Let me pile in on that. I'm Kirby Gross. I'm a trauma surgeon. My career life has been in a brick and mortar facility, but it's been mentioned several times this morning. We have improved case fatality rate. The survivorship of combat casualties is much greater than ever before. And if you drill down at that number, if we think of there's two components. There's the killed in action, deaths before arrival to a medical treatment facility, and those deaths after arrival to a medical treatment facility. The greatest advances have been in those survivorship prior to arrival to a medical treatment facility. So the huge advance has been prior to the arrival to the facilities. Our medics and corpsmen have been doing a great job. One thing we identified, I served as a Joint Theater Trauma System Director in 2013 and 2014, and we noticed our medics were well trained. They were able to apply the principles of point of injury care, tactical combat casualty care guidelines. One of the challenges we saw were their physician oversight were not as familiar with the tactical combat casualty care guidelines. So part of the challenge is to ensure their leadership are familiar with the guidelines and don't stiff-arm our medics who are very knowledgeable about the application of the tactical combat casualty care guidelines. Also, to pile on another point that Colonel Zarnick made about interacting with our civilians. The Institute of Medicine has a term, a learning health system. The learning health system is an organization which is able to evolve and advance. And the National Academy of Science, Engineering, and Medicine published a report earlier this year which is identified as the deployed military health system as a model of a learning health system. And in fact, our civilian partners, civilian colleagues wish to partner with us on examining ways to improve. As an example, we use the term case fatality rate, which we have identified has had significant improvement over these past 15 years of war. I think another metric which we need to look at is preventable death, once again, as Colonel Zarnick mentioned. And the goal of a learning health system is to drive that preventable health number to zero. And in fact, that's the title of our civilian colleague, the National Academy of Science report, driving our preventable death rate to zero. And our civilian colleagues, many of whom are alumni of the deployed trauma system, who went on to academic leadership positions, have identified that over the past 15 years of war, in the civilian realm, there have been between 200 and 300,000 preventable deaths on the civilian side. I say again, between 200 to 300,000 preventable deaths on the civilian side. There have been some preventable deaths in the military side as well. However, with the recognition that we are a learning health system looking to partner with us so we can help drive the civilian numbers down, because the challenge with trauma systems is not only the military, but the civilian side, and actually it's tougher on the civilian side because of a more fragmented command and control. Thank you.
So Kirby, you're saying that actually if we work together and think outside of the box and think forward, we can actually save lives on the battlefield and in the urban setting?
Correct, yes.
What a novel idea.